I learned a long time ago that if I want to have an integrative medicine practice, which I do, then we follow and become aware of the standards of care in medicine for any individual health condition. And so what I mean by that is an old saying that I kind of learned was, just because we think outside of the box, it doesn't mean we ignore what's inside the box. And so there's first-line therapy for mast cell activation syndrome, which is considered standard medicine. And so that's H1 blockers, H2 blockers, and a stabilizing prescription known as cromolyn, gastrocrom in the US, nalcrom in Canada. H1 blockers, again, the over-the-counter ones, plus prescription, Blexten, for example. The H2 blocker, famotidine or Pepcid, and these cromolyn products. In my practice, I'm often using cromolyn and leveraging it a bit more off-label outside of the box to not just be a capsule that you swallow to help, say, the food intolerances associated with mast cell activation, but also, we've kind of learned how to put it in a nebulizer, meaning you can breathe it in if you have the proper equipment and the right prescription, or you can put it into a cream type format with the help of a compounding pharmacy. But that first-line therapy, H1, H2, cromolyn, plus, if you look at some of the pharmaceutical journals, believe it or not, vitamin C shows up there, although it's not often recommended in a standard medical practice. And of course, I think it should be, so we use it all the time. In fact, we use it even intravenously in some patients because it can be a real rescue type situation or intervention for some patients that really need to get that histamine load down. And we do have research that shows that serum histamine levels can be reduced by intravenous vitamin C.